Hello, I'm Tim Dodge, IABNY's Director of Research and Media Relations, and you're watching Part 7 in our video series, Healthcare Reform, What You Need to Know. Today, we're going to look at reduced cost sharing, meaning reduced deductibles and co-payments. A taxpayer may be eligible for reduced cost sharing if he is covered under a qualified health plan at the silver level of coverage in which he enrolled through the exchange, and his household income is between 100 and 400% of the federal poverty line. Now for 2013, this amounts to single taxpayers with incomes between $11,500 and $46,000, and households of four with incomes between $23,600 and $94,000. Taxpayers may claim reduced cost sharing for any month in which they were not eligible for a government-sponsored program, an affordable employer-sponsored plan that covers at least 60% of eligible costs, a plan in which he was enrolled before the healthcare reform law was enacted, or other coverage, such as state-sponsored risk pools. The amount of the reduction depends on the household's income. The lower the income, the greater the cost-sharing reduction. Households with incomes between 100 and 200% of the poverty line get their cost sharing reduced by 2/3. Households with incomes between 200 and 300% will get cost sharing reduced by half, and incomes between 300 and 400% get cost sharing reduced by 1/3. So for example, take a household of four individuals with a household income of $25,000 a year and say that their plan has a maximum out-of-pocket expenses of $1,500 because their income is between 100 and 200% of the poverty line. That $1,500 is reduced to $500, is reduced by 2/3. So their maximum out-of-pocket expense for the year would be $500. Now, in addition, plans have to cover 94% of the cost of benefits for households with incomes between 100 and 150% of the poverty line, 87% for households between 150 and 200, and 73% for households between 200 and 250. No plan has to pay more than 70% of the cost of benefits for households with incomes between 250 and 400%. Now, the way this works is the plan must notify the U.S. Department of Health and Human Services that a plan participant qualifies for reduced cost sharing. HHS then must make regular payments to the plan equal to the amount of the reduction. Reduced cost sharing does not apply to benefits that are over and above the essential health benefits that I described in a prior episode in this series. It also does not apply to pediatric dental plans. Individuals of Native American descent who have incomes below 300% of the poverty line have no cost sharing at all. Individuals who are not U.S. citizens and who are not residing here illegally may not obtain reduced cost sharing. That's all for this episode. I hope you'll tune in for the next episode when I'll discuss the tax credits that are available for small businesses. Thank you for watching. I'm Tim Dodge.